What's up, everybody? You are listening to the Strength and Knowledge Podcast. This is your host, Dr. Zach Baker of Rehab to Perform and R2P Academy. And on today's episode, we have with us again Dr. Seth Hawks, one of our two sports residents who is on the back end of residency right now. We are coming down the home stretch as we finish out the month of May, and he will be off and on to new and exciting things with more details to come on that in the future. But he will be with us most likely through the remainder of the summer, potentially into early fall. We are really just kind of tying up loose ends on the residency here. And today we are doing another research article review. The topic of the month is concussions. So they've been spending time with Paula McCorkle, our physical therapist who runs our Germantown location, and her and Chris Sorreo lead all of the concussion rehab at Rehab to Perform. So they've been doing their didactic lessons with Paula this month. And Seth, do you mind sharing with us what was the article that you selected and why did it stand out to you?
This is one of the ones that I actually went in trying to find a specific topic because it relates back to how my high school was set up, how a lot of high schools really across the country are set up. This article is talking on how the effects of having an athletic trainer at a school, if that has any correlation with knowledge of concussion or reporting of symptoms for the high school athletes. Where I grew up, we did not have an athletic trainer up until my junior year, and even then they were there maybe once every 3 weeks. And I know that a lot of schools around the area here, it's kind of the same thing. A lot of the athletes don't really even know who their trainer is. So I just wanted to find something to discuss on if changes in the outcomes, knowledges, and reporting would be different with an athletic trainer being on staff.
Yeah, and for those who are unfamiliar, we are out of the state of Maryland. So we currently have 10 locations as Rehab to Perform, most of them being in Maryland, a couple in Northern Virginia. And in the state of Maryland, and public and private schools operate a little bit differently, but typically in the public school system, each individual county is responsible essentially for outsourcing athletic trainers. So the county, the Board of Education, the athletic directors, they have to try to find partners within the community, whether it's outpatient PT practices, whether it's hospital systems, whether it's other medical organizations, who then go out and employ the athletic trainer, who then put them in the high school. So there are a lot of steps into getting an athletic trainer into high schools. Some of the local counties are doing a more direct employment route where they're directly employing the athletic trainer and making them an actual employee of the school and of the county. And I will say those counties have been more successful with getting adequate staffing with athletic trainers in their schools. A lot of the counties that we have locations in, and these are pretty well-off counties. They are ones within the DC and Baltimore suburbs, and they are people that you would not anticipate the resources, the funding, or just the availability of athletic trainers to be an issue, but it's multifaceted in regards to getting an athletic trainer into a school. And the reality is, in Frederick County, where we operate out of, more than half of the schools do not have an athletic trainer. So you're in a situation where the ATs who are there, instead of being responsible for one school, they're often covering a region, and they've got to cover 3 or even potentially 4 schools, which is challenging, no matter how great of an AT you are, how organized you are, and just how much time you want to put in. One person can only do so much at one school, let alone covering an entire region of a county. So when you brought this article up, I was pretty excited to hear it because this is stuff that is practically applicable to us as clinicians, being able to educate students who are coming in, student athletes who are coming in, and then also trying to figure out how can we better educate the community as a whole for some of these concussion recognition symptoms, and figuring out, A, if you don't have somebody there who can help you out, do you have the knowledge to recognize when there's an urgent situation or when there's a situation that requires something more than just, rubbing some dirt on it and letting time do its thing. So Seth, do you mind going into a little bit about, what did this article entail? How was it set up? What was the intention of it? Just kind of give us a background on that.
So the big thing with this one is pretty unknown at the time of this being done, how the presence of an AT around the student athletes would affect concussion knowledge, prevention, and recognition. That was really the big aspect, that we didn't have that link So we wanted to be able to check that and see if there is a difference. What they did with this is they had a questionnaire that was sent out to 715 high school athletes. They were all aged 13 to 19, and they went through 14 different schools. 7 of those schools had full-time ATs on staff. The other 7 did not have an AT at all. With this one, it's about 2/3 of the athletes were from those 7 with the full-time ATs. 1/3 was from the schools without ATs. So they sent this, initially they sent out the state mandated concussion education, which included the CDC and prevention's heads up concussion education documents. So they sent that out, but gave no other concussion education. And then the survey that they sent out was a total of 83 questions on figuring out, for one, the athlete demographics, knowledge of concussion, self-understanding of concussion, and then reporting behaviors. There was 35 questions on knowledge of concussion. So this was questions that were asked of them to recognize signs and symptoms of concussions, identify complications related to multiple concussions, and then try to answer questions pertaining to general knowledge of the concussions. On top of that, they had a self-understanding concussion area. So that was a Likert scale question area that it was asking the athletes to report their understanding of the nature of concussion, return to play criteria, and then signs and symptoms of the concussions itself as well. After that, there was a section on reporting behaviors. So these are questions that inquired why athletes would not report concussion symptoms to their AT, coach, parent, teammate, and why they chose to report their concussion symptoms. The last question of it was, if you did not report, why did you not report? So with that, it was 13 different reasons that they could kind of pick from. It ranged from not wanting to miss playing time, not wanting their coach to think that they're a wimp, essentially, not having the funds for health insurance to be able to get checked, things like that. And then it also assessed reporting behavior by asking athletes if they continued to play, even if they felt like they had a concussion, or if they knew that they were showing signs and symptoms of concussion. And then they had the final section being another Likert scale question area that was asking them to rate the importance of concussion knowledge and of reporting the signs and symptoms of the concussions themselves.
That's good. So this is a pretty all-encompassing study, and the big bullet points that they hit was they wanted to get a pretty clear image on what were the demographics that they were working with, and can we find any differentiating factors here between race, age, sex, grade, the sport that they play. What was their overall knowledge of concussions, and can we draw any conclusions on, for those who are more knowledgeable versus those who are less knowledgeable, are they more or less likely to report and seek out care? What was their own self-understanding of concussions? And then when they were reporting these behaviors, what was the reason that they were or were not choosing to report? And I think each one of those sections provides very important information. And in and of themselves, one section alone probably doesn't tell you much. But when you start to piece together this picture, you can start to get an idea of, are we finding any patterning with groups of individuals who are less likely to report symptoms? If they are less likely to report symptoms, why is that? Is it A, just because they don't even know that they ever had a concussion, because they don't know what one looks like and what one feels like and what one should be like? Or two, they're well aware that they have a concussion or they have something going on. They just have other conflicting reasons as to why they're not pursuing care. And that's important to know, because then that allows you to go a whole nother avenue with how you end up addressing that. And is this more of a community-based issue where we need different resources, different things available to them? Or does it go down the other educational route where we need to correct some of these misconceived perceptions that they have? So Seth, we know what we're trying to measure, and they measured it. What did they actually find?
In terms of the knowledge of concussions, that area of the survey, you could get a max of 35 points. With that, the athletes that had access to the ATs, they had higher scores than the athletes without the access to the ATs. So around 3-ish points different on that, which is big in the scheme of things on that one.
Yeah, it speaks good for the ATs. It says that they're doing their job from an education standpoint and from being proactive with these individuals.
On top of that, the self-reported understanding, for understanding of the dangers of concussion, the group that had access to ATs, 94% of them agreed that that was important. With the group that did not have access to ATs, it was more of 87%. So that was a pretty significant difference in percentage-wise.
As I say, whether or not you have one or don't have one, the overwhelming majority are in agreement. And then those that did have the AT are in an even further agreement, almost in uniformity.
And it was the same trend with understanding the signs and symptoms of the concussions as well. So the AT group, 78% of them felt like they understood what the signs and symptoms of the concussions would be. But with the non-AT group, only 61% felt like they had really any idea of how to tell if they had a concussion.
And that's important to me because, I mean, that's a 17% difference. It's one thing to understand the dangers of a concussion, and both groups who had and did not have an AT agreed that most of them understood how dangerous and how significant concussions were. The more concerning part on my end is the group that didn't have an AT, only 61% of them even understood what a concussion looked like. So it's one thing to know, yes, they are important, but if we can't even recognize when we do or don't have one, it doesn't matter what your conviction is on how important they are. So I think across the board, we've seen more favorable outcomes or results with the group that had the athletic trainers. And then when we come down to really the kind of nuts and bolts of this, of understanding, do we even have a concussion or not, or what is the likelihood of do we have one or not, that's where you really start to see the differences between the group that had access to athletic trainers and the group that did not have access.
Yeah, and one thing that I found pretty interesting on this was around 16% more of the athletes that did not have the AT accessible thought that it was permissible to continue playing even if they thought they had a concussion.
Which, for anybody listening, it is not okay to keep playing if you are suspicious of having a concussion. And that's when we start getting into significantly, potentially catastrophic effects of people who are misinformed or ill-informed, or they just don't even know any better and they don't have anybody to provide them that guidance, where a concussion is never a small injury, but you can take steps to reduce the likelihood of it cascading into a potentially traumatic or catastrophic injury through knowledge and prevention and access to some of this information.
One of the other questions was on if they felt like they knew they had a concussion, if they knew they were experiencing those symptoms, if they thought it was acceptable to continue playing. And it was a 12% increase on that as well with the group that did not have ATs. So even then, if they knew for a fact that they probably had a concussion, 12% more of those students were willing to take the risk and be on the field because they don't understand truly what that risk is.
And that's scary because it almost makes you wonder, especially not all concussions look the same. And I start to think back here as a clinician and also as a parent, how many kids are running around on the field knowingly or unknowingly that they have a concussion, which is essentially a traumatic brain injury, and they're either playing because they don't think it's a big deal, they're playing because they know it's a big deal, but they don't really care, or they're playing because they have no clue of what is even going on at this point. Now, the next part of the study is where I'm really interested in hearing what you found, but can you go over some of just the descriptive information on the reporting behaviors that they were demonstrating? And this is where they were, what they were actually reporting, the 13 different questions in regards to why they did or didn't seek out care, or if they were or were not reporting it. But do you mind getting into some of that part of the study?
Yeah, this part is the one that I felt like I could relate to pretty well with not having the ATs at the high school I went to, because I definitely know people that did not report. So in this study, 46% of that 715 students recalled having at least one concussive event in the past. Only 21% of those reported that they had that concussive event. So the sample recalled a total of 383 concussions in practices and games, but only reported 218.
So 46% recalled having a concussive event, but only 21% reported. So we've got 100 student athletes. 46 of them are saying they had a concussion, but only 21 of them are saying that they actually reported it to an authority figure, whether it's the athletic trainer, whether it's their coach, whether it's administrative, whether it's another healthcare professional. That's alarming. 25 of those 100 theoretical people knew they had a concussion or were pretty suspicious that they had one, and they just never said anything about it.
And something that they also did in this survey, they kind of changed the verbiage up. So they would use the word concussion, but also they would use the term like getting your bell rung. Because if you've played football, you've definitely heard a coach tell you that. So that way it would skew fully on for if the student athletes don't really know signs and symptoms of concussion, they probably have heard that, or they have feel like they've experienced, oh, I got my bell rung at practice 2 weeks ago. So with having the verbiage of that along with the concussion verbiage, there was 1,817 events that were recalled, which equates to 5.5 bell ringer incidences per athlete, and only 274 of that 1,800 were reported.
And now that's interesting, because you can look at that a variety of ways. You can look at that, the change in verbiage, where one, you may be having some people that, oh, I got my bell rung, and it just means they got hit pretty hard, but it was a benign hit with regards to not causing any head injury. But I think what you do end up looking at this is when you change that verbiage, you have more people associate a potentially significant event with that verbiage as opposed to concussion. And whether it's because people just don't know what a concussion is, so you ask them, hey, do you have a concussion? And I don't know what that is. I don't know what one looks like or feels like. But when you say, hey, have you ever gotten your bell rung? Oh, yeah, I remember getting cracked back on this play, or I remember rounding the corner. I didn't see the safety coming down and got hit. So sometimes just when you're speaking, especially to like the youth, adolescent, high school, college population, that may resonate more with them. And it's not directly correlated. It doesn't mean like, oh, that big hit was a concussion, but it at least makes them aware of, oh, you know what? I did get hit pretty good. And I've had a hard time sleeping recently, and I haven't been able to concentrate. And I've had this headache that won't go away. And you know what? I've been kind of down recently, and I've been a little bit more irritable. And it may be a good conversation starter.
Those numbers themselves, that was looking at just the whole group combined. So they kind of broke it down into more of that athletes that had the AT, athletes that didn't. So remember, we had almost 400 concussive events reported. We had 1,800 bell ringer events reported. So breaking that down into the schools with the AT, the schools without the AT. So the schools with the AT, combined between concussions and bell ringer events, there's 1,216 recalled, and only 300 were reported. So 24% were reported, even with the athletes that had the ATs. That did show that they had more education and more understanding of concussive symptoms. The non-AT schools, there was 984 concussion and bell ringers combined for the recall, and 191, or less than 20%, were reported for them. So with that, 331 athletes recalled either the bell ringers or concussions, but 55% did not report any bell ringer concussions to an authority figure out of that 331.
That's interesting. Now, what I am really curious about, for those that did have a higher knowledge of concussions, what did that look like with regards to their reporting percentages or reasons for or for not reporting?
The first, number one, was they didn't think it was that serious. They were like, oh, have a little bit of a headache, tired, let me just rest it off. Second most is they didn't want to lose playing time. Especially if you're in your senior year, you don't want to sit out a game. You want to play. Especially if you're not planning on playing in college, like this is the time to shine. So you're not going to sit out if you don't have to. They didn't want to let the team down, was another big one. They didn't want to have to go to the doctor. They thought their parents would be upset. And then they were trying to get that scholarship to play in college. So same thing, like you've got to show out, you've got to impress the scouts. You're going to just keep pushing through typically. One of the ones that grabbed my attention though was they did not have health insurance, and so they could not go to the doctor. So they knew that financially they wouldn't have the option, so they just said, well, I'll just let it do its thing.
It's a pretty helpless feeling as an athlete right there. And I'm looking at the reasons that are listed out, and to preface this, making the point that a higher knowledge of concussion scores when they did the testing earlier was not associated with higher reporting percentages. And these are the reasons why people didn't report. And I am going to list them out, so just bear with me. I didn't think it was serious. I didn't want to lose playing time. I didn't want to let the team down. I didn't want to have to go to the doctor. I thought my parents would be upset. It was the end of the season. I didn't want to miss a game. My team was going to playoffs when it happened. I was trying to get a scholarship to play in college. I didn't know it was a concussion. I thought my teammates would think I'm weak. I thought my coach would get mad. I thought my coach would think I'm weak. The large majority of these answers focus on people other than the athlete. It's focusing on teammates, it's focusing on coaches, it's focusing on parents or family members, which you can take that as a silver lining of, hey, these are selfless kids, but you can also take it as these kids are putting other people's expectations and other people's priorities over their own health and well-being, which you may say that's noble, you may say, however you want to term that, but I think that's a little bit concerning. And I do think from an educational standpoint in the healthcare field, within the community, the more that we can increase the knowledge of concussions and increase the prevention and really what's relay to people, what's standard care. I think a lot of these reasonings, you're always going to have these reasons pop up, but hopefully the frequency at which they pop up becomes less frequent.
So let's break down one more statistic before we get into some of the other topics on it. So for the athletes without the ATs, they were more than 3 times as likely to not report because they didn't want to go to the doctor, and almost 4 times more likely not to report due to not having health insurance. On top of that, approximately 5 times more likely not to report because they didn't know they had a concussion. So it does show that, that difference of having someone there to give just even a little bit more education can help. But on top of that, it tends to be areas where health insurance isn't as prevalent, things like that those schools are the ones that are lacking ATs. So it's very unfortunate. It's sad when you think about it, but the reality is it does happen. So with that, we have to kind of think of what can we do as PTs to try to help mitigate this, try to help get people more involved in taking care of themselves, understanding if they have an issue, and to go get checked.
4 hours, Seth and Abby are going to be going to a local high school sports medicine class, talking to them about concussions. What does concussion recognition look like? What do symptoms look like? What does interventions look like from a PT setting or from a more gross medical standpoint? Guess what that school does not have? They don't have an athletic trainer. So I think, you look at these stats, and I think Seth did a good job of pointing out, unfortunately, a lot of the schools that don't have athletic trainers are in areas of lower socioeconomic status. And for a variety of reasons. Maybe they don't have the population, just the size. So think about maybe potentially your more rural areas. If you are trying to triage situations and you only have one athletic trainer and you have one school that has 4,000 kids in it and another school that has 500 kids in it, you're probably going to put that one athletic trainer at the school that has more kids in it. Then you look at, well, if we have one school that is extremely well funded and another school that is barely scraping by or potentially running at a deficit, which school do you think is more likely to have the funds to bring on an additional staff member, that athletic trainer? Probably the one that is more well funded. So there's a variety of factors that go into this that are admittedly out of our direct control, but I do think recognizing areas that are more prone to having these issues can allow us in the healthcare space to be more proactive with what we do from a community involvement, a community engagement standpoint, and try to provide alternative resources for them. That I'm not going to be naive and say, hey, us going to this high school later on is a substitute for having an athletic trainer, because it's not. We're comparing apples to oranges right there. But it's better than nothing. And I do think that there are some things that we can do to be a little bit more intentional and try to build these relationships.
Yeah, I do feel like the community outreach is a big aspect of that, because that doesn't necessarily mean just specifically going and talking to the athletes. That could be having a meeting with the coaches in the area and saying, hey, these are the signs you should be looking for if you notice that your athlete takes a big hit. If they come off acting a little weird, like these are like the general things you should have an idea of. Like if you see this, you should probably talk with their parents. You should definitely sit them out for the rest of the game and try to advocate for them to go get seen. But on top of that, with us getting to be able to do some of the outreach and the residency, that's one of my favorite things about this. But with that, you can turn that into doing team screenings. Like take one Saturday right before fall sports start. Go do a general functional screening with the athletes, and then have a discussion with them on hey, you play an impact sport. These are the things you need to look for, and this is why it's important. That does not take a crazy amount of time. You get to spend one day, and you can do all of that. And if you happen to work for a company that you feel like is not going to let you do that, as bad as it sounds, you could probably try to tell them hey, this is a really good marketing strategy. We're getting out and putting our name out there, so you can kind of work the system like that. I've had friends do that with companies they work for, but be able to actually get out and do their due diligence and take responsibility, knowing I work in healthcare professions. I should be helping out, even if it's not technically getting me paid. Spend the time to go and advocate for these students, give them what they need to be successful in taking care of themselves, and let them understand it's not just this one moment right now. If you don't take care of yourself long term, there's a lot of consequences.
Before we wrap up here, anything else within the article that we did not touch on or that was of interest to you, or do you think we hit it all?
Really, I feel like we hit it all, and like I said, I grew up in rural Alabama. We did not have an athletic trainer. This resonated with me a lot. I had one friend, he had 5 concussions in high school, and the only reason he knew is because his mom was proactive about it. She worked in healthcare. She had an idea of what to look for. I know for a fact I had at least 3 undiagnosed concussions, but at the time I didn't realize that's what it was. So seeing it from the side of growing up that way and now knowing what I know, to me, I just this is a very important topic that we do need to address more often.
Yeah, and I think from a professional side of things as well, when we talk about multidisciplinary communication, and there's a lot of times that physical therapists, athletic trainers, primary care physicians, orthopedic surgeons, you're going to have mutual patients and your experiences are going to overlap. And I think as physical therapists and just people in healthcare in general, we need to realize, think about patients that you've had come in where you're suspicious of them having a concussion. And you're thinking in the back of your head, gosh, why didn't their AT catch this? Or why didn't their primary care catch this? And guess what? Maybe their AT did catch it and the athlete just didn't do anything about it because they know, hey, if I tell this athletic trainer my head hurts or I'm not feeling well or I got my bell rung, they're going to make me go to the doctor. My mom's going to be mad. My coach is going to think I'm a wuss. My teammates are going to think I'm letting them down. So I do think it is important. One big take-home message I get from this article is no matter how well-intentioned we are as clinicians, whether you're PT, AT, whatever your role is, athletes are going to make decisions whether it is within their best interest or not, or based off your judgment or not. So just making sure we are aware of that and that sometimes the conversation you're having with somebody, it may not be the first time that they've had it. So Seth, as always, this was a great conversation, a really good topic to talk about, one that I think should be top of mind for everybody. As always, thank you for doing the dirty work, finding the research, filtering it, bringing awareness to it. And stay tuned for our next month's episode when we will have Seth back on. And he will only have about 1 or 2 more with us before he has completed residency. Everybody listening, this is the Strength in Knowledge podcast. If you enjoyed this episode, please share, like, and subscribe, and stay tuned for our next episode.